On December 4, 2024, United Healthcare CEO Brian Thompson was fatally shot outside a Midtown Manhattan hotel. The suspect, 26-year-old Luigi Mangione, allegedly committed his act to protest corruption and unfairness in the U.S. healthcare system. Luigi, a 26-year-old computer science graduate from the University of Pennsylvania, was arrested in Altoona, Pennsylvania on December 9, 2024. At the time of his arrest, Mangione was found with a handwritten manifesto criticizing the American healthcare system. Mangione's manifesto expressed frustration with corporate greed in the healthcare sector, particularly targeting insurance companies. He criticized the U.S. healthcare system for being the most expensive globally, while yielding subpar health results. This incident has sparked a wide range of reactions. Some individuals have condemned his actions, emphasizing that violence is not a justified means of protest, while others have expressed sympathy for his frustration with the healthcare system, though not endorsing his methods. But supporters have gathered outside courthouses, some wearing Luigi hats, viewing him as a symbol of resistance against corporate greed in healthcare. In my opinion, murder is never acceptable, no matter what the reason is, but unfortunately, there is a reason why he's gained so many followers. Unfortunately, the US has a very broken and horrible healthcare system that is in need of serious reform. Big food companies, big pharma, and the insurance companies benefit from a flawed system where Americans are getting sicker and poorer, but at the same time, these companies are getting wealthier. As of 2024, the average American spends approximately $15,000 per year on healthcare costs, a number that is consistently rising each year. This figure encompasses all healthcare-related expenses, including hospital services, physician visits, prescription medication, and insurance. And these extremely high prices are one of the main reasons that Americans are going into debt. Medical debt has become a significant issue in the United States, leading many individuals and families into financial distress, even despite the implementation of government programs like Medicare and Medicaid. According to a report by the Kaiser Family Foundation, approximately 41% of U.S. citizens carry some form of medical debt, with 24% considering bankruptcy as a means to address it. In fact, medical bills are responsible for 62% of U.S. bankruptcies, affecting 1.2 million Americans annually. Imagine getting a bill for thousands of dollars after a surgery or a hospital stay. Even if you're insured, you still have to deal with crazy deductibles, out-of-pocket costs, and the constant stress of figuring out how to pay for these bills. This all takes a serious toll on mental health, and people start losing sleep, getting anxious, and feeling hopeless. And it's not just a bad mood, it's real mental health issues like depression and anxieties that are spiraling out of control. A study from Johns Hopkins showed that people with anxiety or depression are way more likely to have medical debt. It's a vicious cycle. The stress of debt makes their health worse, and their worsening health makes the debt even harder to manage. But you may say, what if I pay for health insurance? Shouldn't I not need to worry about cost because my insurance company will cover it? That's what we think about. That's what insurance is for, right? But unfortunately, that's not how it works in the United States. The harsh reality is having health insurance doesn't always mean you're safe from medical debts. For example, deductibles. This is the amount you have to pay out of your own pocket before your insurance even kicks in. For some plans, that can be thousands and thousands of dollars. So if you end up in the hospital, well, you're going to have to pay a huge chunk before your insurance pays a dime. Even after your deductible is met, you still owe a fee called a copayment every time you see a doctor or fill out a prescription or visit the ER. And this all adds up pretty quickly. And your insurance might decide not to even cover certain treatments or specialists or medications. And who pays for that? You do. The fact is, health insurance companies have gained a lot of power in America, which means they can set the prices and terms for insurance with little competition. This makes it easy for them to raise costs for consumers without much resistance. For example, the top 5 health insurers in the United States have increased their yearly profits by 230% in the past decade. The main goal of these insurance companies is to make as much profit as possible, often at the cost of patients. Insurance companies routinely reject claims to save themselves money, which leaves patients stuck with medical bills they thought their insurance would cover. United Healthcare Group, for example, was notorious for this. It reportedly denies nearly 1 in 3 claims from its policyholders. And this isn't just a fluke. This is a business model designed to prioritize profits over people.
United Healthcare CEO Brian Thompson has set off a wave of rage over medical claims denials. South Florida is included in that. CBS News Miami's Joe Murray has been talking to United Healthcare policyholders about their frustrations and is live tonight in Fort Lauderdale with more on the story. Joan.
A game of pickleball can leave Wesley William Parker out of breath, but that wasn't always true. An accomplished high school wrestler, he was 7th in the state last year, but during a match sophomore year, he suffered a serious nose injury, an injury that required surgery, but he said his insurance company, United Healthcare, would not cover all of it.
And most of it had to have been paid out of pocket, and it was like thousands of dollars, and I had to say no to the surgery amongst, so now I just kind of have to live with it.
This happens because when a patient files a claim, they often discover that their insurance doesn't cover the treatment or procedure they thought it would. Insurance policies use purposely vague or technical language, making it hard for everyday people to understand what services are actually included. For example, a patient might go to an emergency room thinking it's covered by insurance, only to find out later that the hospital was out of network or not covered by the insurance company, leading to thousands and thousands of dollars in unexpected bills. Even if the hospital is insured by the company, they may unknowingly receive care from providers during a visit who are not included in the insurance, like an anesthesiologist or radiologist, and then come home and receive a letter that they owe thousands of dollars. However, the problems with the healthcare system don't end there. The pharmaceutical industry, commonly referred to as big pharma, also plays a huge role in increasing healthcare costs through practices such as price gouging, patient manipulation, and extensive political lobbying. An example of this is insulin, a life-saving medication for those with diabetes. Insulin has experienced a dramatic price increase over the past 2 decades. In 1999, a vial of insulin cost about $21, but by 2019, the price had skyrocketed to approximately $332, making that an increase of over 1,000%. The main reason for the high cost of insulin is the presence of a vulnerable population that needs insulin to survive. This population, which numbers in the millions, is willing to pay anything to have access to a life-saving drug. The desperate need for a life-saving product allows insulin to be priced at high levels because it's not a luxury item that one can forgo. The manufacturers of insulin know that patients who need it will spend whatever it takes to get it, regardless of the price, because it's a matter of life and death. Also, pharmaceutical companies often engage in a practice known as evergreening, where they make minor modifications to existing drugs to expand their patent protection and delay the entry of more affordable generic alternatives. This strategy involves obtaining new patents for slight changes, such as altering the drug's formulation or delivery method, effectively prolonging their market exclusivity and monopoly. For example, a study revealed that between 2005 and 2015, 74% of new drug patents were for existing medications, not new ones. This tactic keeps drug prices high by preventing competition, allowing companies to maintain their monopolies on their products. To keep this monopoly and control, the pharmaceutical industry invests a lot of money in lobbying efforts to influence legislation and maintain favorable conditions for their operations. In 2023, for example, the industry spent over $383 million on lobbying, more than all other sectors. This money is spent to sway politicians against implementing regulations that would control drug prices or increase transparency. For instance, the Pharmaceutical Research and Manufacturers of America, a leading trade group, spent almost $30 million in lobbying in 2022 to oppose measures aimed at reducing drug costs. For instance, a study comparing drug prices found that U.S. prescription drug prices are on average almost 3 times higher than 33 other countries. And as of the most recent report, it's estimated that Americans on average spend slightly over $1,000 each year on medicine. Despite the fact that these companies literally bribe our government, many politicians in America purposely appease the pharmaceutical companies because of one simple reason. It's something called the revolving door, like the ones you see in a hotel. The revolving door refers to the movement of personnel between roles as legislators or regulators and positions in industries affected by the legislation and regulation they oversee. So basically, our politicians pass laws that favor these corporations, and they get high-position jobs after they retire from the government, like Billy Tauzin. Billy Tauzin, a former U.S. congressman who played a pivotal role in passing the Medicare prescription drug bill, which prohibited the government from negotiating drug prices. Shortly after that, he became the head of the Pharmaceutical Research and Manufacturers of America, earning a very lucrative salary. This is just one example out of so many, and it shows how, unfortunately, the US works less like a democracy and more like an oligarchy, where wealthy insurance companies and pharmaceutical companies can buy our politicians and influence their votes. So as long as big pharmaceutical companies can manipulate our politics, and as long as there are no regulations to punish insurance companies from deceiving and harming Americans, Americans will continue to pay an unbearable amount on healthcare and will continue to go deeper and deeper into debt. Thank you so much for watching this video, guys. If you enjoyed this video and you want to watch more, make sure to click on this video here or this video here. Make sure to leave a like, as it will help promote this video to others here on YouTube. It's totally free for you, but it means so much to me. Thank you so much, and I'll see you in the next video. Take care.